Doctors themselves are too expensive?
All of them. All of them.
One has to be at least your major concern. Yeah. Well, I have a list for you. I have a list for you, and I'll read it out loud and tell me what you think is the one, yeah? So nursing, no, it's not the top, is it? Okay. Medical, physicians will be the top. I got this one. I got this one before. I did this 4 times around the kingdom, 3 times around the kingdom, and this is the 4th. I've yet to get an answer. Not a single time I did get an answer from a healthcare provider, which is interesting.
Hospital care.
Hospital care. Not really. See, we're all here and we still don't know what attributes to our pocket drainage, is how I would say.
Admin service.
Hospital.
Rejected insurance.
Rejected insurance. Okay, we'll get to that. We'll get to that.
Others.
Well, obviously, I wouldn't get anywhere. I really would like to, engage you in the discussion. Actually, it's not physician drugs. Some other people. It's not drugs. It's not physicians. Some other people said, it's property. It's biomedical supplies. Unfortunately, no.
What's admin?
Others.
So it's actually, no, it's not. Bravo, you see? Okay, you have 13.2% of the change in the expenditure for administrative costs. And that's actually Title 2 of HEP, Administrative Simplicity. Yeah? So you actually have the highest expenditure in administration. Now this is what of course this study is according to the HA. That was your question.
Where is the data from?
Yeah, this is actually according to the HA. I thought you would figure it out because I have the HA logo here.
Okay.
Yeah.
Okay.
And it's below that it says the source. So, and this is from Medicare and Medicaid in the US. So I would imagine that even if we're better than them, we'll still be at what, 10%? 7%? That's huge money. You said $1 billion. Okay, so let's look at the hospitals. Let's look at your cost again. Why would we save? This is again according to the HA, and this is the ratio of what I call the PC to PW, patient care to paperwork. So what we're looking at here is the ratio of the amount of paperwork that you need to do at the time that takes you to do paperwork for a procedure. So if we, for example, take skilled nursing care, it will actually be you will do 1 hour of patient care. For that, you'll do 13 minutes of paperwork. Does that sound too much? Too little. Interesting. We have one of the largest hospitals in the Eastern Province, okay, which is, thank you for supporting me, Hassan. So let's see, if anybody was gonna, challenge this, that's the calculation over there. I was just thinking that 1 hour of skilled care, it means 6 average visits. Each one of them is almost 10 minutes, yeah? So it takes you 6 times to actually go, get the file, get the right documents, write the accurate update, vitals, procedures, case progress, get doctor signature, then file the document back. That all, I suppose, I'll be very conservative and give you 5 minutes for. Again, too little? Thank you. Okay. I would assume you have the best nursing on the whole planet. So that's 5 by 6, that's 30 minutes. Yeah? So we actually have a huge amount of paperwork and cost for paperwork. Now let's look at you again, poor hospitals. They're actually, they really are doing their best to get into the best technologies. As we can see, the huge cost again hits us. The traditional technologies are moving. Now, before you had X-rays for $170,000. Now you're looking at CAT scanners for $1 million. And again, you're looking at imaging with PET now for 2 or 3 millions. So the costs are increasing, even which is funny actually, the scalpel, which isn't, scalpel, a surgeon, a scalpel, it's $20, $10 kind of thing. Now they're looking at electrocuttery, which is $12,000 for each surgeon. Harmonic scalpel, $30,000. Amazing. It really is. Okay, now this is another interesting. It's more of like like the one you presented for Holland, and this is actually again the government regulations are very cumbersome. I mean this is for the states, yeah, but I believe each country has its own complications, and off the record, nobody has complications more than us. We like to keep it hard. So let's look at who's in the middle here. So do you believe actually you're in the middle of this? Can you imagine being in the middle of this? Or would you like to be in the middle of this? Very dramatic, thank you. All right, so anybody who counts quickly, do you know what are the entities that you're talking to? You don't have much time. 1, 2, 3, 4, 10. You have 29 directs and 38 total. 38 entities, each have their own different systems. You still have to talk to all of them in their own ways, and their government, so you have to talk to them their own language. Okay? So this is a kind of complication that you're at. Would you like to focus on this? Or focus on the nice things like quality care, which brings more people? All right, so I reached to the money side, and this is the really interesting thing. I think I used to call this 90% sale, but it didn't sound so good, but I said that's why I put less here. It's more of a prestigious thing. But it is, I mean, the word 90% really attracts you anywhere. No matter where you see the 90 or 80 or 70%, you're really attracted. So I think you will be attracted when you look at the numbers that I have in for you. The costs, according to Government Group of Stamford, Connecticut, the paper cost is for a claim is about $10 to $8.5 per claim. All the way, this is follow-through costing, of course. I'm not talking about the cost of the paper, I'm talking about the cost of the paper moving whole the organization. From the minute the guys come in until you actually get your money. For electronic, they're estimating $1. Again, the same numbers were actually verified by PwC and Milman and Robertson. They said that actually payers and HMOs are actually spending $8 to $11 per claim. Also, HCPs there, which means healthcare providers, again, $8. You're actually spending $8. And even if you're better than the Americans by 50%, you're still spending $4. Okay, so that's huge. For electronic, it's just a mere single $1 and even less. Especially when the economy of scale helps you and helps the industry that's moving the electronic claims. Let's look at other factors. Any CFOs around will be very, very happy to see this. The cash flows on paper is actually 2 to 6 months to get your money. So imagine if you have 6 insurance companies, each of them, are actually liable for you for 1 or 2 millions. You multiply that by the number, you get your account receivable, and that's a lot. And the rejection nowadays is actually around, somebody mentioned the rejection, who was it? I don't know, but it was talking about 30% rejection average. And this rejection is due to so many things. I can sit here all day and tell you about rejections, because there are so many reasons. A lot of them are related to the data. Huge amount of them. That's why the study here says you're actually gonna move from 30% to 2 to 3% rejection, which again relates to medical necessities and stuff like that. The industry figures which we spoke about, actually the guys also mentioned, is the United States spends $250 billion on paperwork. That's a huge number of money, that's a huge amount of money. Of course, for electronic option, they are estimated to spend $25 billion. Now, this means we've got $225 billion saving from 250 to 25. Very simple math. Yeah. So going as a holistic idea, as what happens when all this happens. Now, if all the if we go nicely or if we don't go nicely, what happens? Now, when payers delays payments, it directly translates to policy holders, which means your insurers, which means the guys you want to take care of. Providers then sometimes actually